Hi everyone, my name is Emily Swingley. I'm going to be speaking about the national natural disaster that occurred specifically in New Orleans, Louisiana. Have you ever been affected by a natural disaster? For some in 2005, there were a lot of people who can answer yes to that question. Sure, California has earthquakes. Sure, Missouri and Oklahoma and Arkansas, they have tornadoes. But the ocean is a different story. This natural disaster killed hundreds of and prolonged effects for their survivors, including upper and lower respiratory symptoms and problems. This is an important topic to know and understand so that future efforts to eliminate these preventable health complications can be solved. Bloom et al. States in their research article, molds and mycotoxins in dust from water-damaged homes in New Orleans after Hurricane Katrina from indoor air, understand the devastating effects of how mold can pose a threat on human health. Why were there no preventative actions taken to eliminate the chance that mold could come into human contact? In order to understand the preventative measures and health effects included, I ask you to continue to listen. In this speech, I will be speaking about what preventative measures could have been taken to prevent survivors being in contact with the toxic mold, and how to prevent upper and lower respiratory problems in the future disasters. First, preventative measures include personal protective equipment, also known as PPE. PPE includes respirators, which are face masks, and full body protection like suits. It can also include gloves. Bloom et al. States that about 30% of Hurricane Katrina survivors wore PPE during their cleanup efforts in the mold-infected areas. This is still a substantial amount of individuals who were affected by the mold, even considering that they were wearing it. That also shows a large percentage that were not wearing protective equipment. These individuals wanted to get their homes in livable conditions, which is very plausible. It's a very important thing to remember, because when you're displaced from your home and you have to live on a street or in shelters or in hospitals, it really gives you a sense of it gives you a motive to want a sense of belonging and want to be home again. If there was a policy in place to make it mandatory that people have PPE, then these illnesses would have been prevented. Additionally, PPE needs to be available for those affected in natural disasters. Hospitals and health organizations need to be able to support large quantities of people along with PPE for them. Cummings et al. States in the article, health effects of exposure to water-damaged New Orleans homes 6 months after Hurricane Katrina and Rita, that there is a need for policies to be in place for cleanup practices. It should be an organization's job to supply the public with cleanup help, such as sanitary workers who already have PPE. It shouldn't be up to the public to fend for themselves. Safety precautions are very important in order to keep the utmost health of individuals and protect individuals from harmful air and water particles. In conclusion, there were a lot of people whose health was affected by this natural disaster. PPE is important to have with any cleanup practice, especially those who are working on structures with mold. Further, policies need to be put into place so that the public is supplied with PPE and cleanup help is given to reduce the exposure to toxic mold. If you were in this situation, wouldn't you want the help from your community to protect your health?